province-wide stay-at-home order expires on June 2nd. The government is still targeting the week of June 14th to begin phase 1 of the reopening. That's when we can look forward to patio dining with a maximum table of 4, and when non-essential stores will reopen with a 15% cap on capacity. But very soon there will be a new doctor in charge of the pandemic and reopening. Ontario's top doctor, Dr. David Williams, who delayed his retirement, is now stepping down on June 25th.
On the advice of the Chief Medical Officer of Health. We worked with our Chief Medical Officer of Health, with consultation with our Chief Medical Officer.
He is the one person Premier Doug Ford has consistently and repeatedly said he's taking pandemic advice from. Dr. David Williams was appointed by the previous Liberal government and was thrown into the spotlight when the pandemic struck.
It's been an honour to serve the people of Ontario.
Williams has taken heavy criticism for his lack of clear communication and for being slow to respond to COVID. For example, early in the pandemic, he did not quickly follow BC's lead and stop PSWs from working in multiple long-term care homes to prevent spread.
The kind of leadership that says, let's do nothing while we review the evidence, let's not adhere to, say, the precautionary principle, which is when you're not sure, take the safer route. We didn't do that. We never did that all the way through.
Epidemiologist Colin Furness has been calling for Dr. Williams to resign since last July. He applauds the government's new pick to replace him.
Our supply is roughly 10,000 doses a week.
Dr. Kieran Moore, the medical officer of health for Kingston. The opposition says the normal selection process didn't take place for this important role.
We usually have a committee that sits and discusses the chief medical officer replacements. That didn't happen, and we think that we need to be engaged.
Doug Ford has said he and Dr. Williams were always aligned. However, they don't appear to be when it comes to reopening schools. Williams said last week he's been pushing for a few weeks for them to reopen. Ford still hasn't made a decision. The health minister insists retiring now was solely up to Dr. Williams.
Dr. Williams is doing this entirely on his own.
Thank you, everybody, for doing a fantastic job.
What needs to change? What are you hoping Dr. Moore will do differently?
First and foremost, we need a plan to open schools in the fall. All the discussion we're having right now around schools, all the hand-wringing, all the disappointment, all the anger, all the rage, all the uncertainty, it's all because we haven't measured. We have done nothing. We have just ignored schools. We've pretended that they're not a problem.
The decisions Ontario made to handle the pandemic will surely be analyzed for years to come, and Dr. Williams' role in making them. Now, he also supports a new vaccination policy for long-term care workers. As of July 1st, they either have to show proof of vaccination, give a documented medical reason why they can't be vaccinated, or take an educational program about the benefits versus the risks of not being vaccinated. Approximately 66% of staff are fully immunized with 2 doses. Now, back to the school issue. The pressure is mounting on the Ford government to announce whether or not in-class learning will resume for June. Adrian Gobriel is tracking that story.